A common question I get from patients is, how do I stop feeling so wired? And the answer is in the reset, our ability to de-escalate during stressful moments. That's the question we're answering here. What is an effective, quick, and science-backed technique that can help you de-stress during those moments of feeling overwhelmed and on edge? Today, we're deconstructing the Vagal Hack, understanding what the research shows when meditation and breath work are put head to head, followed by a live demonstration so you can see that nervous system shift in real time. By the end of this video, you'll have a go-to reset for those high stress moments. And best part is, it takes just a few minutes to save your day. Think of your autonomic nervous system like a seesaw. On one side, you have the sympathetic system, and that's your fight or flight. On the other side, you have the parasympathetic, which is our rest and digest. When you are stressed, you are in sympathetic overdrive. So the goal is to swing the seesaw to the parasympathetic system. Meditation is a top-down approach. We're using our mind to calm our body. Now, there are hundreds of studies that show the benefits of regularly practiced meditation. However, when we are stressed and our minds are running 100 miles per minute, sitting still can actually feel more stressful. Breath work is a bottom-up approach. You use your body to force your brain to calm down through the vagus nerve. As the longest nerve of the autonomic nervous system, it is responsible for a variety of functions, including heart rate regulation, gastrointestinal peristalsis, sweating, speech, and inflammation. Today, as we focus on its effects on stress reduction, think of the vagus nerve as a brake pedal for your heart. When you breathe in a specific way, you are mechanically and chemically forcing that brake pedal down. And here's how. When we exhale, the diaphragm rises and the chest cavity gets smaller. This causes a pressure change which is sensed by baroreceptors in the heart and blood vessels. They send a high priority message up the vagus nerve to the brain. The brain realizes it needs to slow the heart rate down to maintain balance. The vagus nerve then releases acetylcholine, which acts like a chemical stop sign and tells the heart to slow down. As your heart rate drops, that physiological seesaw tilts towards your parasympathetic system, and you feel that wave of relaxation. In a study published in 2023 by Dr. Spiegel and Huberman of Stanford University, along with other scientists, approximately 100 participants were assigned to various treatment groups, mindful meditation, and then 3 controlled breathing groups, and they were followed for 1 month. Through questionnaires completed every day before and after their assigned practice, they found that the group practicing cyclic breathing, also known as cyclic sighing, reported the most change in positive effect and therefore improved mood by the end of the month. Also, participants in the cyclic breathing group showed significantly lower resting breath rate as compared to the mindfulness or other controlled breathing groups. So now that we know the science and benefits of cyclic breathing, I'm going to put it to test. Okay, so I did a couple of jumping jacks to get into a semi-stressed state. So let's see what happens with a couple of rounds of cyclic breathing. All right, so I did another couple of jumping jacks, and now I'm curious to see what happens with heart rate and respiratory rate with meditation. So here today, we could see that decrease in heart rate through the vagus nerve with both techniques of cyclic breathing and meditation. Now, we did see a more significant drop in respiratory rate with cyclic breathing as they saw in the study. And I must say that wave of calm and relaxation that happens with the prolonged exhale during cyclic breathing is really quite special. So I think for me, during those high stress moments, I have 5 minutes to reset my day and save it. I would definitely have to choose cyclic breathing. Ultimately, optimal health isn't a single habit, it's a toolkit. Combining controlled breath work with mindful meditation and professional mental health care is the most effective way to build long-term resilience. I'm Dr. Raj, board-certified family medicine physician. I hope you found this information helpful here today, and I look forward to seeing you back next week.